All right. Amazing. So I think we can go ahead and get started and folks will join us when they can. But greetings, everyone. Thank you so much for joining us today for our webinar introducing NASTAD's third-party TelePrEP programs, partnership considerations resources. My name is Nicole Elenoff, and I'm a senior manager on NASTAD's prevention team. And I'm joined today by one of NASTAD's incredible TelePrEP access consultants, Cody Schaefer-Fritz. And this webinar will further walk through the third-party TelePrEP programs and the resources developed to assist programs determining to partner or strengthen their current partnerships with these programs. So this webinar will be 60 minutes, including time for question and answer and other discussion. We ask that you keep your lines muted to encourage good sound quality. This webinar will be recorded, and we also will be sharing these slides afterwards. Please feel free to add questions at any time in the chat, and we'll have some discussion at the end. And yeah, thank you so much again for joining. So our session today, we're going to have a very brief background about why we're doing, why we developed these resources. I'll then turn it over to Cody to do a delivery model overview. He'll dive deeper into how third-party TelePrEP programs work and operate and how it typically works through business model-wise. Then there will be a discussion about the different resources. So it'll be a full resource walkthrough, and we'll just share a brief preview of what's to come, and then we'll have some Q&A and discussion. I know some folks shared some questions in the registration beforehand, so thank you for doing that. And yeah, I know some folks started saying hello in the chat. Feel free to use the chat and discuss while we have this conversation. So some background. So as I'm sure many of you have seen, third-party TelePrEP has rapidly expanded and is now available in all 50 states. And when I'm saying third-party TelePrEP, and Cody's going to go over this a little bit more in depth in a moment, third-party TelePrEP programs are typically commercial providers that an organization will partner with to expand PrEP resources through telehealth. And that's like a very brief overview that will be dived into a little bit more. But these third-party providers are available in all 50 states, and NASTAD's seen a significant increase in these partnerships with COVID-19 being a major catalyst. So as I'm sure many folks can imagine, there are many benefits with partnering with a third-party program, being able to expand PrEP access to different parts of the state. Maybe telehealth isn't possible for a program internally, so partnering with another outside resource can help expand access and reach. But we've also heard some of the challenges that have come with these partnerships. And we've heard from organizations in the field that have had difficulties with patient record retention, contract negotiation. And so some of the resources that have been developed speak directly to those. We also heard from patients about challenges with patient navigation, customer service, and cost transparency. Over the last several years, through NASTAD's TelePrEP access work, we've had conversations with different programs about, their partnerships and what they wish that they knew at the time. And we've utilized that information into some of the resources we developed. So that's just some brief background. And I'm going to pass it over to Cody to dive a little deeper in this delivery model.
Great, thanks, Nicole, and good afternoon, everyone, or good morning for those for whom it may still be morning. Happy to be here today and to walk you through this, so we can move on to the next slide. So, as Nicole said and gave a brief introduction to, when we're talking about third-party TelePrEP programs or models, we're really talking about commercial entities that are providing TelePrEP services directly to clients. And most often, this is happening in partnership with community-based organizations and other service providers. And just so to synthesize how these relationships work, from a business perspective, it's important to understand that these entities, these third-party providers, are essentially acting as a contracted provider with their partner organization, which is, in this case, the community-based organization, who often, if not always, is a 340B covered entity. And so these third-party commercial programs then agree to provide a specific set of services on behalf of that organization, such as the telehealth platform, client recruitment, marketing, app-based recruitment, identifying and contracting and managing the providers and prescribers who are part of their program, coordinating labs either locally or through self-collected labs, and then writing and managing prescriptions. In return for that set of services, the covered entity or local organization agrees then to pay a routine fee per patient served in return for those provided services. So while often these services are presented as free or minimally or at minimum cost to the patients that they're serving, that's because the cost of care is being passed on to the local organization that's partnering with these third-party entities. And so typically, as we said, services are provided at no or minimal cost for the patient and rely then on those associated 340B drug pricing program cost savings to pay the fees to that commercial entity. And if we can go to the next slide, we will see here in just a moment, sort of a snapshot of how this process works in a 7-step system, as well as how data and money are flowing between partners at each of those steps. This is pulled directly from one of the resources that we are releasing as part of this webinar. So you can definitely get more context there, but just briefly, as we said, the first step is that the covered entity or local organization contracts with this third-party service. That service then will identify and contract with eligible prescribers within that region and facilitate establishing an MOU or an MOA between the covered entity and that selected prescriber who will be providing services on behalf of the third party. The third-party service then advertises, recruits, and enrolls patients, and notes with those patients that as part of that service, they are establishing care with the covered entity or the local organization with whom they're partnered. The prescriber, in this case, provides the patient care on behalf of the covered entity, utilizing the third-party services platform and documenting the provision of care within the third-party system. The prescriber then sends the patient's prescription to the covered entity's contracted pharmacy, and then cost savings from that prescription that are generated from that prescription are directed back to the covered entity, and then used to pay the fees for the third-party service. So it essentially creates a cycle of agreements and fund flow that are happening sort of around the patient experience within these partnerships. And you can see that all four folks or all four sort of buckets of interested individuals are involved in this, from the covered entity, the third-party service provider, the contracted prescriber, the pharmacy, which is not listed here, but then also the patient themselves. Next slide. So when we think about this system that is actually somewhat complex and nuanced and very layered, it's important for anybody who is engaged in or considering engaging in third-party partnerships to have a really finite understanding of a few basic and foundational important facts. And that's acknowledging first that clients who are recruited into these programs are consenting to become patients of the local partner or covered entity. They are not patients of the third-party service provider. In this case, contracted providers even aren't employees of the third-party entity, but are contracted, and then that MOU or MOA is facilitated to provide that very specific service within a specific geographic region. As such, compliance with 340B drug pricing program requirements then are fully the responsibility of the local partner or covered entity who has entered into these agreements. And it's very important that we acknowledge that these third-party entities across their programs and across regions within which they operate do not provide uniform linkage to care, retention, or adherence supports to patients participating in these services, typically leaving those for the local partner or covered entity to find some way to address as part of their workflow and their commitment to serving patients. So in short here, it's really that the obligation to the patient and the obligation to 340B covered entity requirements live wholly with the partner who is entering into this agreement. And the third party provider is really insulated in terms of what they are responsible for, and what they're required to deliver as part of these agreements. Next slide. So due to that complexity and the compliance burden that has been placed on local partners and covered entities, and based on all the feedback that Nicole shared in her introduction today, this really prompted us to come together and think about what resources we could develop to assist those of you who are already engaged in, or those who might be considering partnerships with third-party entities who are providing these services. And this boiled down into 3 areas that we identified as being really important. And the first is an evaluation considerations and decision-making tool. And this tool really is meant to be a starting point for organizations who are considering TelePrEP services. And it's going to give you an opportunity, and we'll preview this in a moment, but it's really intended to give folks an opportunity to go through a decision-making process with some questions and some ranking tools to help you understand, based on the needs of your organization and what you would like to see come out of a TelePrEP service or program operating in your jurisdiction or in partnership with your organization, what the best pathway might be, in terms of weighing options against each other, in terms of whether a third-party service provider makes the most sense to meet your needs, or if a homegrown TelePrEP service may be more beneficial based on the needs that are identified as part of that assessment tool. And so in these instances, if you decide a third-party provider is not for you, then this tool also links you to some other NASTAD resources that can assist with developing and implementing a homegrown TelePrEP program. But for those who may then consider or may decide as an outcome of that tool that a third-party service provider really makes the most sense to meet your needs at any given time, then we lead into tool number 2 that we'll discuss today, which is the patient record retention and compliance strategies tool. And this tool is really meant to serve as a sort of structural overview for organizations to understand their responsibilities in terms of patient record retention and storage related to their 340B covered entity status, so that they can be protected in terms of surviving an audit and making sure that they're compliant with all the terms and conditions of their CE status. And finally, a third tool, which we won't be reviewing today, but we wanted to mention that is still under review, is a third tool on defensive contracting. And these are strategies meant to support community-based organizations and covered entities who do ultimately decide to enter into these relationships with third-party TelePrEP provider services to ensure that you have the information and the skills, or the information readily available that you may need to negotiate favorable contract terms, to ensure that you are meeting those compliance standards and providing the best level of patient care through these programs and agreements. Next slide. And with that, we'll just go ahead and dive straight into the resource walkthrough, starting with tool number 1. So this is our evaluation considerations and decision-making tool. And as I said, this tool is really meant to be a starting point. It lays some foundational groundwork to help you understand, how you might want to evaluate the best pathway forward between a commercial service or a homegrown service. And we can go forward here. So as I said, it's aiming to assist all of our partners to compare these self-administered programs with third-party services. The tool is interactive in its format, allowing users to answer a series of questions related to different program components, rating both the importance of agency influence in each of the component areas, but also identifying how important it is for agencies to have influence in each of these areas. And influence in the context of this tool is really talking about your ability to have an effect on the design, development, implementation, and operational practices of each of these areas. And with that, this is exactly what the tool looks like. And you can see we've got a couple different areas on this slide. So starting with client recruitment, and this is really meant to understand how you feel about the strategies and activities that are utilized to increase awareness of your program and engage prospective clients or patients. And so you're asked to rate on a scale of 1 to 5, how important is it that your agency has influence over how potential clients into a TelePrEP service or program occurs? And you rate that on 1 to 5, with 1 being less influence and 5 being maximum influence. And then as the supplemental question to that is, or sorry, that was importance was step 1, excuse me. And then step 2 then is how much influence does your agency want to have over the recruitment? So not only how important is it that you have input, but how much input do you want to have? And again, rating on a scale of 1 to 5, with 5 being maximum and 1 being less. The next section explores navigation, and this is, we're really assessing the strategies and activities that are utilized to support patients in accessing PrEP, and that includes insurance coverage, other assistance programs, as well as ancillary support services that individuals may need access to in order to not only initiate PrEP, but to persist through the cycle of PrEP care to meet their needs. And again, rating here, how important is it that you have influence, and how much influence do you want to have in this area? Next slide. And then we move on to provider training, specifically focusing on cultural humility and responsiveness. And so assessing here, how important is it to you and how much influence do you want to have over training and support to PrEP prescribers who are providing these services and providing patient care on behalf of your organization to ensure that they're informed by cultural humility and responsiveness. And again, with all of these are going to have the same question, the 1 to 5 rating on how important is it that you have influence, and then the 1 to 5 rating on how much influence do you want to have. The next section is really focused on care provision, specifically related to retention. And these are strategies and activities intended to support patient retention and persistence in PrEP care. Next slide. Moving on, we stay with care provision for one more section where we're really trying to assess ancillary services. And these are strategies and activities that are intended to support patients by connecting them to other services and supports that may benefit their overall well-being, while also increasing the likelihood that they will persist in PrEP care. We all know that PrEP doesn't exist in its own microcosm or its own universe, and that there are very often other supports or resources that are needed for those who are accessing PrEP care. So this question is really trying to get at that. And then discontinuation and transfers. And this is talking about practices in place to support patients who elect to permanently or temporarily discontinue PrEP care or transfer care to another provider. So trying to assess here how important is it that you have influence, and how much influence would you like to have? Next slide, please. And that is the assessment section of this tool. We really tried to make it user-friendly and interactive and boil it down to what we heard from all of our partners and folks that we've been working to support in terms of like what areas really need to be identified and assessed in this decision-making process. And so that tool is going to compute a number or an assessment score for you that falls in the range of 14 to 70. And you can see on the slide here that the 14 to 28 range really means that there's less importance for you to be actively involved in those areas, and that you need or want or desire a lower level of influence for the majority of those areas. For 28 to 56, we're looking at medium importance and medium influence, and we'll dive into what that means here in just a second. And then from 56 to 70, we're looking at high importance and high influence really across the board based on your answers. So starting with the purple, which is less importance and less influence, this is the area when the assessment says it's not very important for you to retain a high level of influence related to the development and implementation of your program. And in these cases, we acknowledge that a third-party TelePrEP program may work very well to meet your program's needs. When third-party programs are engaged, we mention here that you need to be mindful of defensive contracting strategies, which leads into the supplemental tools that are also being developed, and that you need to employ practices to ensure compliance with 340B record storage and retention, which again, this leads into the other two tools that we'll highlight today. Next slide. For folks falling into the medium category, we note here that a third-party service may meet your program's needs if the contracting terms can be negotiated to meet the specific needs of your organization. And this is because it's somewhere in the assessment you indicated that you needed to have a higher level of influence and be more actively involved in specific areas of operations of the program. And in order to do that, we have to acknowledge that the need for that really needs to be addressed within the contracting and agreement development process. And so it's really important then to address that through contract negotiations with defensive contracting strategies. We also note, though, that if contracting terms cannot be negotiated to meet those specific needs of an organization, a self-administered program model may be preferred for you in these instances. And finally, we have the high importance and high influence section. And this is when the tool captures that it is very important for you to have a high level of influence across multiple program areas and be actively involved in the different stages of client recruitment, care, retention, and discontinuation supports. And we acknowledge here that for folks who fall into this category, it may be most beneficial for you to explore development of a self-administered TelePrEP program within your organization. And I'll note here, as I mentioned earlier, that for folks interested in developing or growing a self-administered program, NASTAD and our TelePrEP access and support team has been working for several years on developing a TelePrEP online learning series, which is a self-guided e-learning series that can really walk you through how to think about and go about developing a self-administered TelePrEP program. And then I would also just remind you that NASTAD remains available to support you in a more one-on-one role as you work through that program or that process if this is the route you want to pursue. Next slide. And so that completes the overview of our initial tool, which again is intended to help you make a decision about what pathway works best for you. And our next tool is really for those who decide to partner with third-party programs. We heard from a lot of folks that there was confusion or a lack of clarity around obligations related to record retention, storage, and sharing within their existing relationships with these third-party providers. And that really informed the development of this tool, which is meant to act as a supplemental support, again, to help covered entities understand what their obligations, responsibilities, and potentially what their best practices can be in these relationships. So next slide. And I want to start here just to illustrate the point by sharing a quote that we received from a jurisdiction with whom we did an interview who was in one of these relationships. And what they shared with us is that the burden of compliance for our organization was not clear when we entered into our agreement with their third-party provider. They acknowledge that while it may have been included in our contract language, we did not fully understand our compliance responsibilities as it related to 340B. The actual storage of the required documentation was not explicitly stated in our agreement or our understanding. And this really set off some alarms for a lot of people, myself included, because compliance with 340B drug pricing program requirements is incredibly important. And folks who are found to be non-compliant could ultimately lose their 340B covered entity status and lose access to all the supports and resources that really make client care robust in these settings and extend care to more individuals. So this resource really dives into how compliance requirements for local organizations who are covered entities are impacted here by first clarifying that covered entities, as we talked about, who are the agencies who are responsible for serving the clients through these relationships, you are the ones ultimately obligated to ensure compliance with all standards and requirements of the program consistent with your registration as a covered entity. And this means compliance not only with HRSA's 340B drug pricing program policies, but also compliance with the federal grant or local grant that gives you access to be covered as a 340B covered entity. So it's incredibly important to have that at front of mind when pursuing and operating within these relationships. And in many cases, these third-party TelePrEP providers are collecting patient-level data within the third-party provider's data system and maintaining those records there as the primary source. And in these cases, where patient records are primarily maintained in an external database or managed by the contracted service, covered, covered entities are vulnerable to non-compliance with program requirements if you aren't ensuring that the third-party provider is meeting the store and forward requirements of providing contracted care, meaning that they are seeing the individuals but forwarding the primary record of care back to the covered entity or agency with whom they're contracted. Next slide. And as such, we also recommend some actions that agencies can take when entering into and operating within these spaces. And the first is ensuring that there is very direct disclosure to clients and patients. So ensuring that individuals registering as patients with that third-party service are informed of how their data will be collected, shared, and stored. And I've seen in some of these intake and registration forms when somebody is signing up for a third-party service that this is a footnote buried in 8-point text at the bottom of the consent form. And what we're advocating for is that this should be more prominent and that patients should really understand who they are becoming a patient of and who they can reach out to and who their support services are. And as such, we think or we recommend you should also provide contact information for your agency or the covered entity to ensure that these patients can reach you should they have questions or concerns related to service, quality of care, or handling of their medical record data. Just further reinforcing that the primary relationship is with your organization and that this third-party service is a service that is being provided to them, but are not actually the providers of their care as a whole. We also separately recommend exploring and negotiating terms around system interoperability. So ensure that your organization as the covered entity and the contracted service provider are compliant with current electronic medical record or EMR best practices and standards to ensure interoperability across systems and facilitate streamlined and compliant record handling and storage to make sure that those patient records are moving from the third-party TelePrEP service provider system, again, into your medical record system so that you are meeting that compliance threshold and maintaining the record of care that was provided as a covered entity to a qualifying patient. Next slide. And then we go through several recommended strategies around record retention, storage, and forwarding more explicitly. And we dive into these in depth within the tool itself, but just to highlight these for the purpose of today's discussion, we recommend negotiating contract terms that protect how patient records are handled and routinely forwarded to the covered entity or extracted into the covered entity's medical record. We recommend establishing defined intervals for auto forwarding of records with as much frequency as possible to minimize the potential loss of records. We acknowledge that not every covered entity has robust technological capacity and in many cases may not have fully functioning EMRs. So in cases where auto forwarding is not possible, we recommend exploring options to routinely extract patient records, potentially working with developers who can write code for auto extraction to get those records back into your agency's hands. We also note that beyond just the 340B requirements, as I said, you need to ensure compliance with your agency or funder data security requirements related to patient records, and ensure that your patient records are complete and contain all required variables to meet those compliance thresholds with all interested parties. Next slide. And lastly, I just want to end with this additional quote that we got from some of our fact finding with agencies who are participating in third-party programs. And they said our third-party TelePrEP program does not provide follow-up with reactive tests or provide supports related to medication adherence, persistence, discontinuation, or enrolled patients otherwise falling out of care. Our navigators do not have direct access to the contracted providers and instead must route inquiries through the third-party program's support platform. And I share this with you as part of our discussion today because I really want to stress and highlight that record retention and timely sharing of records is about so much more than compliance. It's also about retention and it's about patient care. Because if you aren't seeing the records for the patients who are receiving services as part of your organization through these relationships, you are not well positioned to provide them the same level of care that somebody may get if they were walking through your doors. If you don't see that people aren't filling their prescriptions or that they've missed their appointments or that they're, at threat of falling out of care, you lose the opportunity to intervene. If you don't see right away that somebody had a syphilis diagnosis or a rectal gonorrhea diagnosis, you lose out on the opportunity to intervene in real time and disrupt potential transmission and link those individuals to care and other supports that they may need, and that, quite honestly, within these systems are not getting, because these third-party providers who offer a phenomenal service and are certainly operating to help close the gap around PrEP access across the country, they are solely and wholly focused on the provision of PrEP prescriptions to individuals. And for a lot of folks, this works, and that's what they need, and it's what they want. It's a very straight and direct opportunity to get PrEP in a demedicalized way on your schedule without having to go through hurdles and barriers that can often be associated with traditional brick and mortar or in-person care. But for organizations who are entering into these relationships, it's incredibly important to think about ways that you can use record extraction and record review to identify opportunities to provide whole person supports to these individuals who are accessing PrEP. Because as I said earlier, PrEP does not and was never intended to exist within a microcosm that was free of all other concerns or healthcare needs of these individuals. And so just really driving home that when you enter into these relationships, these folks are your patients. They are patients of your programs. They are receiving qualifying services. They are eligible for 340B. They fall under your obligations as a 340B covered entity. And timely and accurate record retention is a dominant and necessary strategy to ensure that your organization has the capacity to really provide all of these extra services and supports that they may not, and certainly from what we've heard, are not getting through these third-party service providers. And with that, and my brief soapbox, that is our highlight of the resources that we've developed to support folks today. As I said, there is a third tool as part of this package around defensive contracting for these relationships that is in development, and we anticipate it being released soon. And with that, I'll hand it back to Nicole.
Thank you so much, Cody. Really appreciate you taking us on a deep dive of those resources. And would love to open the floor up for some Q&A and discussion. Would love to hear, folks' questions. I know that Cody briefly, really well explained the whole, how this model works, but I know for those that might not be as familiar, it was a little fast. So if you had any questions at any point, would love to hear them. Okay. I am wondering if there are folks that feel like they'd like to share any experiences, or if they had any resources that they would like further us to look into a little bit more. I'm also gonna stop sharing. I know we have like 40 some people in here, and I'm also gonna pause our recording for thanks for that discussion, resharing slides. If you all have a question at any point or want to discuss these things further, you can absolutely reach out to us. I'm just going to jump to our contact information. And yeah, really appreciate everyone's time today to go over these resources and, for what they shared and asked during the discussion. Yeah. We also have our PrEP Access listserv. So feel free to sign up for that. We'll be sharing updates on that site if you haven't signed up yet. I guess another announcement while we have a couple moments, NASTAD is having a TelePrEP/PrEP office hour next Wednesday at 3 o'clock Eastern. And this office hour is going to be really spending time talking about TelePrEP and PrEP promotion. I know that it's been a really busy month in public health world. We have National HIV Testing Day coming up, but we also have it's Pride Month. So would love to talk a little bit about how folks are promoting PrEP during Pride Month and for National Testing Day. And you can sign up for that office hour on the link that I just put in the chat. And yeah, really appreciate everyone's time. It's hot out here. Drink some water and enjoy the rest of your Pride Month, National HIV Testing Day, all of the things that you all have going on. And yeah, thank you so much. We'll talk to you all soon. Have a good one.
Thanks, everyone.
Thanks.